should you quit medicine or should you stay? Hi, I'm Dr. Selena. I'm the co-founder of Disruptive Doctors. Disruptive Doctors is a platform for doctors to impact healthcare differently. Now, as I'm running Disruptive Doctors, I get to speak a lot to junior doctors, and a lot of them ask, or rather skirt around this question, wondering if they should quit before completing their training, before getting their license. A lot of them have asked, should they go into a non-clinical career straight? When should they start looking for it? And what are the non-clinical career options? Now, my advice is, although I do advocate that there are more to just being in the hospital, there are a lot of things that doctors can do within healthcare to impact patients' care and patient outcome. But for junior doctors, this would be my advice for you. One, if you are thinking of a career in healthcare, I would always advise you to complete your housemanship training and get your APC or your license before venturing out into a non-clinical career. Simply because you will build a lot more credibility for yourself. People will trust you more. You know what you're talking about. If you're fixing a problem within the healthcare system, if you've already gone through your training and your compulsory service, you know exactly where the problems are. And if you're going to come up with a solution, it will be a solution that makes sense. As opposed to someone who hasn't completed your training, you came in for a couple of months and then you jump into some other career. I'm not saying it's not possible. It is possible. There are people who have done it. If you're all right to start at a very basic level like everybody else, then it's not an issue, right? But if you want to build credibility for yourself, if you want to be the authority in the healthcare space, get your experience. Here's the thing, right? As a doctor, you can become a web developer. You just have to learn how to use ChatGPT, watch a couple of videos, you can develop a website. But a web developer cannot become a doctor without going through the 5-6 years of medical school like you did, or go through all that training in the hospital like you did. So I would advise you to take advantage of that position because it will really help you set yourself apart from everybody else who is also applying for that same job. Now, if you found a lot of our content useful, be sure to like, subscribe, and share our content.
Join Disruptive Doctors. Oh, Disruptive Doctors. Impact